Hey guys, it's Dr. Greg with Judice Sports and Rehab, back again this Friday. And today we're going to be talking about shoulder injuries on the Cardinals disabled list, as well as shoulder injuries in golf. Specifically, we had the PGA tournament here about 3 weeks ago, so kind of a current event, so we'll get into that a little bit today. So let's start off. We got 4 different players on the Cardinals right now with shoulder issues. Okay, 2 of them are out for the year. That's Alex Reyes and Luke Gregerson. Luke Gregerson's injury is kind of an undisclosed, unknown, unstated, but he's on the 60-day DL and he'll be out for the rest of the year. He hasn't pitched much for us. We just picked him up this offseason and haven't seen much of him this year. But Alex Reyes is obviously a big stud, a big part of our future as Cardinals fans here. And he's out for the year with a lat tear after coming back from Tommy John last year. So really hoping he can get that back together this year. But lat is basically very large muscle that comes and inserts on the underside of the humerus there. And it helps with that throwing motion, that pulling down motion. So it's kind of important. So it's understandable that he's out for the year. That's a big time surgery. So we've got 2 players on the 10-day DL that we hope to see back pretty soon. We got Mike Myers, who's out with shoulder inflammation, which is kind of a generic term to say the least. Doesn't tell us much, but we can assume he's just got some minor shoulder issues and that he'll be back pretty soon. Nothing really too concerned about that. He's been an awesome bullpen piece for us so far, and hopefully he can keep that together. We've had pretty good bullpen for the last 10 series wins in a row. That's pretty awesome. And then Marcelo Ozuna. I think that one was kind of a, while we're doing well, let's take advantage of everybody else being pretty hot and doing really well right now. Let him rest. If you've watched him throw from the outfield, he's not looked good all year. So he's not had a whole lot of velocity on his throws, and he's looks pretty uncomfortable with throwing, but obviously he's been able to get the job done in the outfield. But as soon as he can get back in the lineup, that would obviously be a good thing for us. So, you know, we got a lot of different injuries in baseball, and we talked last month about elbow injuries and why they take so long. And the same thing applies here. Is once the injury is fixed, whether that's surgically or with therapy, it still takes that person time to get back to full speed activities. It's not like one of us just trying to reach up into the cabinet. It's trying to throw 95 miles an hour. And so there's a little bit more force involved. So it takes quite a bit longer to get back to sport. So be patient with them. They'll be back. And then a pretty cool current event here in St. Louis. We had the PGA tournament a few weeks ago at Bellerive. And I didn't particularly see any shoulder injuries myself, but I do see several folks here with shoulder pain that I treat that are golfers. And so I wanted to talk about some of the most common things that I see with shoulder injuries, specifically in golfers. So there's 2 main motions that are required of the actual shoulders themselves. And that's that front shoulder. So if I'm right-handed, I'm pulling back this way. It's that front shoulder being able to reach all the way back for that backswing, and then the back shoulder being able to rotate. So when that combines, you get into that set position at the top of the swing. And both of those positions can be uncomfortable. This across the body position is actually a test that we use for impingement. So if someone is not able to get into that position comfortably, they may have impingement and would need some mobility and some strength to kind of stabilize that so it doesn't become a lasting issue. And then that max rotation back this direction, that can also be a pretty uncomfortable thing depending on the person, depending on what's going on with them. But you know, I see that pretty frequently, especially in your over 55 golfers. You've got some stiffness through the joints that's whether or not it's associated with arthritis doesn't matter, but there may be a lack of mobility leading to kind of an overuse or a compensation because of the lack of mobility, and then there might be some pain associated with that. So those are 2 of the biggest things I see. But then I wanted to also talk about the connection between the shoulder blade, and the thoracic spine. So the thoracic spine is kind of that mid-back area. They all work together. So if you don't have good shoulder blade mobility and strength, that force has to go somewhere, and sometimes it goes to the mid-back, sometimes it goes to the low back, and sometimes it goes to the shoulders. So keeping your shoulders and shoulder blade and thoracic spine as mobile and strong as possible is really important, because it'll help take a lot of the stress off of the low back, which is one of the more common injuries in golfing. So while shoulder injuries are not necessarily common, shoulder limitations are common, and they can lead to compensations that cause other issues down that chain. So just be aware of that. Really focus on that shoulder blade strengthening if you're going to the gym, or make sure you're working on your range of motion through your shoulders so that you're not beating up your low back while you're doing that. And I think that pretty much concludes that for this week. We'll be back again next Friday. We'll have Monday off for the holiday, obviously, but we'll be back next Friday, and we'll have a new month, so we'll have a new body region. So we'll announce that next week, and hope to see you guys then. Thanks.